Health and Wellbeing Board meeting on the 28th of November. This is a live streamed meeting, and yeah, so we have, just to make everyone aware. Do we have any apologies?
Yes, Chair, I've had apologies from Melanie O'Rourke, Councillor Karim, Alex Guild and Grania Siggins. Are there any others I should be aware of? No, thank you. I think we've still got a few people to join us, so hopefully they'll come as we join.
Okay, fantastic. All right, thank you. And do we have any declarations of interest? So members are asked to declare any disclosable pecuniary or affected interest in respect of any matter to be considered at this meeting. No? Okay, thank you. Do we have any urgent items of business?
No, Chair, none notified. Thank you.
Okay, thank you very much. Can we approve the minutes from the previous meeting? I've had a read and I'd like to approve them. Is there anyone who can second it? Is Nicola Airy with us yet?
She's not. No, I haven't heard from her, so I'm hoping she's on her way.
Nicola, sorry to interrupt. Nicola will be joining. I'm just deputising on her behalf as part.
Okay, all right, Ben. It's because it's usually Nicola who seconds the minutes, and she's usually got one. Okay.
I see. She's planning to join, but I said I'd jump on until she was able to. So yeah, apologies for the first part of the meeting from Nicola.
No worries, that's fine.
I'm happy to second the minutes. I was here last time.
Okay, fantastic. Thank you very much. Okay, are there any matters arising from those minutes? I've got a couple, but there might not be the right people here to answer the questions at the moment. I was just looking at the report. Obviously, we had the report on in the matters arising. Last time we talked about vaccination rates, and I was just interested in if we had any further news on vaccination rates, because I noticed that the flu and COVID vaccine uptake for the ICBs in general is low. I saw that in a report, and I just wondered if we had any more localised information and any updates on that. I don't know if there's anyone available to answer that at the moment.
Yeah, I can answer that one, Councillor Wright. So we have had further insight reported back to the Health Protection Forum for East Berkshire that does drill down in some degree to local Bracknell Forest areas. Bracknell Forest is performing really well across the winter vaccination and is one of the highest areas in the country. I think it is in respect to the new RSV vaccination. So there's no concern with the vaccination rates for the borough as a whole. That said, as per the action that I've raised at the last discussion, and I've raised it again at the Health Protection Forum with our colleagues at NHS England who oversee vaccination programme and therefore the data, whether we can look to getting some more granular level data that really hones down a much more localised level, because we know there is variation across the borough. So that action's in progress, and hopefully something that we can report back to with some further insight, and the dashboard which we're coming on to, we can look to capture some of that as well moving forward. So conversations are in play. Overall, it's the levels are looking positive for Bracknell Forest, but there's more work to be done.
Okay, fantastic. And then this again slightly comes up later in the meeting, but in the minutes from the last meeting, we talked about the youth work and having a failed bid to work with South Hill Park, and that they were going to they were looking for alternatives. And I was just wondering if there's been any progress on this, or if we're just sticking to a youth model where we go into schools on their own, or if or if the youth team is still looking for that venue to work in. I just wondered if there was any update there.
Not sure that we would know that
Okay.
with the people on the call today. So we'll take that one away and pick that up with Audrey Johnson in the early help team.
Okay, brilliant. All right, thank you. They were just my little questions from the rereading the minutes. Any other matters arising?
Councillor Wright, not a matter arising, but just because there are some new faces, is it worth us introducing ourselves when we speak, or do you want to go around the screen?
I was at the start. There were so few of us; it didn't really seem. Okay, that would be great. So there's 12 of us on this call now. Ben, I've not met you before, so yes, it would be great to say hello to everyone. Let me just work out how I can see you all, and then I can gallery view. There we are. So right, I'll just start with who I see on my screen first, and if you could just say hello, who you are, and what's brought you to the Health and Wellbeing meeting. Thank you. So Lizzie, if we start with you.
Yep. So hello everyone, I'm the clerk to the Health and Wellbeing Board. Thank you.
Brilliant, thank you. Andrew, you're next to my...
Hi, I'm Andrew Hunter. I'm the Exec Director for Place at Bracknell Forest.
Thank you very much. Paul Beale.
Hi there, I'm Paul Beale. I'm the new chair of the East Berkshire Health Watch.
Brilliant, fantastic. Now I've got Shamarke. Thank you.
Hi, my name is Shamarke. I'm a public health practitioner leading on health intelligence in the public health team in Bracknell Forest.
Brilliant, thank you. Jonathan.
Hi, Jonathan Pickin. I'm the business manager of the Safeguarding Board, supporting the work of safeguarding partners to have oversight of all age safeguarding matters for children and adults.
Brilliant, thank you. Charlotte.
Hello all, I'm Charlotte Pavitt, Director of Public Health for Bracknell Forest Council.
Brilliant, fantastic. Abby.
Hi all, I'm Abby Thomas. I'm the Assistant Director for Communities and Policy at Bracknell Forest Council.
Okay, fantastic. Ben.
Hi, Councillor. Good to meet you. I'm the integration lead for Bracknell Forest, working for Frimley ICB. So I work with Martha and then with Nicola as well, and deputising on her behalf until she joins today.
Fantastic, thank you. I've got Philip next. Thanks.
Thank you, Chair. So Philip Bell, CEO for Involved Community Services. So I'm the voluntary sector lead on the board. Thank you.
Fantastic. And then I've got Louise. Louise, good.
Hi, I'm Louise. I'm a development officer at Berkshire Care Association. So I think you'd normally have either Fidelma or Sue Dorling on the call, but they're both unavailable.
Okay, fantastic. And then Joanna.
Hi, my name's Jo Dixon. I'm the manager of Health Watch in Bracknell Forest, standing in for Nick Derman.
Okay, fantastic. Have I missed anyone? Sorry, it's hard when you talk, you go to the top of the list. So I think I've got everyone. And I'm Megan Wright, and I'm the Cabinet Member for Health and Adult Services at Bracknell Forest Council. Okay, thank you. Right, I think there were a couple more to join, but I think that would be most of us for now. If we could then move on to public participation. Do we have any questions for public participation?
No, Chair, we haven't received any for this meeting.
Okay, fantastic. All right, so now we're on to agenda item 7, Health and Wellbeing Board Strategy Update. I think that's with Charlotte, is it? And Shamarke?
Yeah, yeah, I'm happy to go first. Let me just sort of share my screen. Hopefully you're all able to see my screen. Yeah, just to sort of give an overview. Yeah, so I've been working on health and wellbeing strategy dashboard, capturing all the indicators that are related to the health and wellbeing strategy. I initially gave an update in the last health and wellbeing board meeting where I presented an outline of what it was going to look like, and following feedback, I've done some further work. So the purpose of this report and the purpose of this presentation is to just give a quick overview of the work that I've done and next steps as I look to sort of deliver the final strategy dashboard. Just sort of
Shamarke, just coming in, do you want to share the slides so that they're slightly larger for the screen for everybody to see? That'd be great.
Just a second. That'd be better?
Much better, thank you.
Yeah, yeah, so yeah, thanks for that. Yeah, so essentially what I want to do is just to quickly go over progress made as well as next steps. I did send out a link, but apologies, what I didn't realize is that there's a bit of a security issue with the Power BI dashboard where it's where I'm unable to share with people outside the organization. And given the makeup of the Health and Wellbeing Board and the number of people outside the organization, I thought I would export it a couple of pages to a PowerPoint presentation and then sort of work with IT to try and get you direct access to the dashboard. It shouldn't be an issue for the final version because we're looking to publish that on a public-facing website where anyone can access it. Yeah, so just sort of quick overview of what the dashboard looks like. Initially, so there's a home page which sets out the health and wellbeing strategy dashboard. Consists of the different health and wellbeing strategy priorities, as well as these panels that give you a direct link to each of the individual front covers. Using priority 1 as an example, you get a front cover essentially mirrors what's in the health and wellbeing strategy document, which tells essentially what priority 1 is, why it's a priority, what outcomes you plan to deliver, and what are the indicators and interventions. So users have the ability to click on any of the panels, but as if we're looking at priority 1, you're able to also click on the priority 1 indicators. So the individual indicators are presented as summary KPIs, which essentially gives you the title of the specific indicator, the latest number, figure, as well as the year or the time period this data is for. Each individual page then links to a hidden page, which is essentially the main part of the dashboard, which gives you an overview of all the relevant details, as well as the data interpretation and key actions related to the specific indicator. So you've got the opportunity to click on one of them. So as you click on them, you then presented with the actual page. So using this specific page, looking at prevalence of overweight in reception age 4 to 5 from the National Child Measurement Program, you're essentially presented, and it's similar across a lot of the pages with so the KPI visual, 5-year trend, as well as the national regional benchmarks. You're also given 2 boxes that have the interpretation as well as what the results mean. So the why is this important and what does this mean? These are updates will be updated once the full dashboard is done on a quarterly basis. So the interpretation will match what's in there and individuals are able to use. I think one of the benefits of having a dashboard in this format is that it gives the user the ability to actually use individual visuals. So you've got options to right click, copy the individual charts, tables onto your own reports, onto your own presentation. So should you want to present a report on a particular indicator or on a particular area within the health and wellbeing strategy, you're able to use this data quite easily. Try to keep the sort of user interface as simple as possible. I know that in the previous meeting, there was a suggestion to have it to include a how-to page, but what I've done is I've tried to keep it as simple as possible so that essentially anyone including members of the public, can go into it and able to use the data how they wish. Each individual chart or table has underlying data you're able to access by clicking on the individual charts. So the example that I've used is a public health intelligence-led indicator. So these are indicators that the public health team has access to. They're usually publicly available data from the Office of National Statistics, NHS Digital, and other such agencies. And those are the ones that we take ownership of and that we update and sort of check for regularly. Then you've got the program-generated indicators. So program-generated indicators are essentially the indicators that emanate from the health and wellbeing strategy that are tracked by partners and other members of the public health team that are responsible for a particular area. So an example that I've got here is for the community map. One of the things that we track for the community map is the number of active assets. So what would happen is that this data will be provided to me by the person who's responsible for this. I would then update the individual charts, and they would also provide me with essentially the important bit with sort of what does this mean, as well as the key actions. So in this case, I was provided the latest data for the number of active assets on the community map, and then provided to what the text for what does this mean and the key actions. So for the program generated indicators, you'll have the key action box, which tells you essentially based on this data, what are we going to do to improve what we have for the indicator, or what are the next steps. So yeah, moving on sort of to next steps. There are quite a number of indicators that need to be updated on the dashboard. So I've requested the data for these indicators. So for example, the data related to mental health in schools teams. So I'm in the process of getting this data, and I'll be building the pages and the indicators for these. The program leads and partners responsible for the program generated indicators will provide the text to me so I can update these so that we have a full dashboard. At the start of next year, so in January, I will go through a data refresh. So for the publicly available data, I'll do the annual updates because those are sort of only available sort of once every year essentially. And then for the program generated data, I'll do the quarterly updates. And then the hope is that in the sort of the early next year, so hopefully for March, end of February, that I'll have published the complete dashboard to publicly accessible websites. Currently sort of still looking at where exactly. But the idea is that this will be publicly available. And we'll also resolve the issue of the current dashboard only being accessible by people within the organizations. Yeah, so that essentially in a nutshell is the progress with health and wellbeing strategy dashboard. I hope that the plan is, and the ambition is to have it all done by the next health and wellbeing board meeting. So yeah, I'm happy to sort of take any questions. Yeah.
Thank you, Shamaki. That was fantastic. Do we have any questions? I can see Charlotte's got her hand up. Go for it, Charlotte.
You're muted.
Muted, yeah.
Apologies, I can't find the electronic hand or the mute button, it seems. So thank you for that, Shamaki. Thank you, Chair. There was just a few points that I wanted to raise on the back of that presentation. I think in terms of that, the last request, and it's an ask and an action of board members to take that point around partner in data and insight, and where the request has been received by your organisation or your team, then please do submit that data so that we can tie that in and complete the dashboard. So it was just to reiterate that ask, really. For me, the use of this data moving forward, I think this will be a really useful tool for us to dovetail onto the other part of this update, which is the progress against the actions, and for us to really hone in and look at any of those indicators that there is a change in trend or a deterioration in the outcome that we're monitoring, for us to be able to then look at what is the action that's currently going ahead. Do we need to review that? Do we need to change that program of work or increase the focus or the prioritization in that area? So really for us to not only see the information and be informed by it, but for that to actually then follow through and inform the work of the Health and Wellbeing Board action plan that we've got in place. The other bits that I wanted to highlight was the opportunity for this to develop. So we appreciate this development has come towards the end of the existing strategy, but there is room now. We've got the foundations in place for us to be able to tweak and amend and be dynamic to where that refresh of that health and wellbeing strategy goes. We're also going to be looking at it, complementing and dovetailing onto the joint strategic needs assessment. So this is one element of that wider joint strategic needs assessment, and all of the other pieces of work that we're undertaking in terms of health intelligence, both within public health and within our organisation, Bracknell Forest Council, and in the wider system as well. So that's a piece of work that this very much ties into. And what I'd really like to get to a space at the moment, the dashboard, and I've said it in previous meetings, it is a retrospective look at performance. It needs to get to a place where we are doing modelling and we're looking forward, because again, that will give us the insight to inform our prioritisation and our target areas. And then the final thing that I wanted to say was a note on training. And we're really keen that once this dashboard is developed, members of the Health and Wellbeing Board actively are able to use that to inform their work programmes over and above what's going on and being monitored by the Health and Wellbeing Board. And so again, with time, we'll look to explore with yourselves training needs and develop a programme to make sure that it's accessible to use too. So that was just really to add on to what Shamak has already said. Thank you.
Right. Thank you, Charlotte. Brilliant. I mean, it's really exciting. I love a bit of data. It's fantastic. I think Andrew, you had your hand up next. Is that right? You don't have numbers like you do on Teams.
Maybe. It took me ages to find the hand. So for anyone who you just have to press the heart, and it seems to give you the option. I was doing the thing to the side of it. Charlotte, you've said pretty much everything I was going to say about how we need to use the data to lead into the next health and wellbeing strategy, so that we are using the data to lead us into kind of what are the priorities coming forward. One question, and it might not be an easy answer, but I don't know why we don't publish this now. I know it's not complete, but when I looked through it yesterday, lots of it just says under development. Well, you see websites with that on all the time. I just think there's some really good stuff in here already, and I think people would really appreciate getting access to it. But that may be difficult while developing it. So it's maybe something to take away, but just a thought.
No, I completely understand that point. What I would say is, I think what we sort of need to do is find somewhere that is sort of either public health portal or somewhere that in a website belonging to the public health team where we can publish it. I think because it's currently under development, I think maybe better just to wait a couple of months until it's sort of there, and then we can sort of put it sort of publicly somewhere. In the meantime, what I can do for people within the organization is to share a link, and then they can sort of start using it. But in order to get that to people outside the organization, it might need to be a couple of months sort of before sort of published online. And I think it might be worth waiting for that, given the number of indicators that still sort of need to be developed.
Thank you. Susan Halliwell.
Thank you, and apologies for arriving a little bit late. So I missed the beginning of the presentation, but I did have a look at it beforehand because I got really excited about all the data and how it was presented. So not wishing to repeat what's already been said, and yes, I too struggled to find the hand. Maybe it's an aversion of wanting to press the heart button because I didn't want a whole load of hearts flurrying into the conversation. So very much agree with everything that's said. I think the work that's gone into this is testament to you and the team, and the opportunities I think this now presents in making sure that the work and activity that we do is evidence-led, and we focus on the outcomes, and we use this data to really show the impact that the activity of the Health and Wellbeing Board is actually having, is an amazing tool to have. So very much recognise that this is kind of the baseline, and I think it now presents us with the opportunities that we've got to then integrate with other service areas, other partners, and really pull all of our oversight of the data that we own, in one place. Absolutely hear what you say, Shamaki, around let's just maybe keep it a draft at the moment. Maybe if we set ourselves an ambition to have it publicised before the next Health and Wellbeing Board, or at the time of the next Health and Wellbeing Board, that would be amazing, I think, because I think it will really generate an exciting level of energy, I think. Just well done to everyone involved in it. It's great to see this kind of real-time display of what's actually happening on the ground in the place.
Completely agree. Yeah, it's really exciting. Charlotte.
Yeah, it's just on that point, and I think Shamaki and I can take an action to explore an interim publication of that. I think the main barrier is where we're going to host it, and actually, if we do keep it internal to staff, we can look at an interim position. So a bit of a compromise in the waiting until it's perfectly polished before we go outward looking, but actually internally we could start and use the individuals using it as a way of us testing and further developing and improving it. So we'll take that away for to report back next time.
Paul, I can see you've got your hand up.
Yeah, I've just found the hand myself. Yeah, brilliant, fantastic data. And we're just really curious at HealthWatch really to look at some of this stuff and to work with you guys in public health. So we're doing some development work early January, February to obviously to look at our work plan from April really. So really would welcome getting the data sooner rather than later. And I've taken a note of your names and stuff. I'd really like to come and have a chat with you guys as well. I live in obviously in the local area in Bracknell, and I'm sort of on my induction program at the moment and sort of trying to get up to speed on things. So delighted to be here and fantastic data. Well done.
Fantastic. Thank you, Charlotte.
Paul would really welcome that, and I think as well another development really, probably poor Shamak is probably panicking here with all my developments, but in terms of capturing the voice and the insight and the information that HealthWatch brings into this is going to be really important moving forward as well. So we are conscious it's quantitatively focused at the moment, but we'd really like to develop into more of the quantitative, the rich picture, the case studies, etc., and capture that too within it where feasible. So yeah, look forward to catching up.
Okay, thank you.
Okay, fantastic. Just quickly, this occurred to me as we're talking about it. Once it goes live and is accessible, will that mean that the data, as we update the data, it will be easily accessible by the public? Is that how it will work? Yeah, go on.
Sorry, wasn't able to find a hand. Yes, yeah. So I think that's the idea. It will be for both people, both partners, sort of stakeholders, including the public, to have access to that data and get real-time data. I think it's just the way it works with Dashboard is a lot of the work is in developing. Updating data is actually quite straightforward. Just updating the back end with sort of whatever new data you want and then refreshing it. So yeah, the idea is for it to be publicly accessible and people to be free to use data how they think is best.
Okay, fantastic. Thank you.
That's all right. You just went on mute halfway through your sentence.
Oops, sorry about that. We've also got our old dashboard, which was shared in the agenda. Are we? Is this where we're going to talk about that now? So our reporting against priorities.
Yes. So I was just going to pick that up. As we come to the sort of end of the life course of the strategy, most of it is green and has been completed or previously reported on. So I was just going to focus on the few red and amber pieces. One being around the suicide prevention agenda. There's been change in staffing across Berkshire. So this is a programme of work that's delivered as Berkshire as a whole with local action groups focusing on specific localised place actions. It's the Berkshire piece that has taken quite a bit of time to really gain momentum because of the number of staff changes. So that is now, we've got a Berkshire-wide suicide prevention group. It's meeting as we speak, and we have a permanent consultant in public health in West Berkshire who is leading on that piece of work for Berkshire as a whole. So that is the reason for that delay. It hasn't slipped off of the agenda completely. It's just taken time as a result of the challenges around staffing. Moving on to the mental health and the development and the incorporation of the workplace wellbeing charter, again as a result of staff turnover and changes, that's something that hasn't progressed but is still being picked up. We have within Bracknell Forest, we have a change program where workforce and wellbeing is part of that change program, so it's being picked up there. And we have a significant program of work that's going on with our businesses as well. So once again, whilst the original action was set for the adoption of such a charter, the work programme has evolved in slightly different realms, and therefore that's why that's coming up as an amber one. But just to reassure the Health and Wellbeing Board, the activity is still going on in that place. And then finally, the obesity actions. And again, this is a result of a shift in programme work. Originally, we did have a commission service for tier 1 weight management. As we have evaluated the outcomes of that service and the uptake of that service, it was performing poorly. Individuals weren't either were being referred and not uptake was low, or the dropout rate was high, and the outcomes were poor. And so the decision was made to not continue to fund that service, and instead there's a wider piece of work now underway, reviewing the entire pathway of weight management from tier 1 and the awareness raising and the community-based approaches right the way through to tiers 3 and 4 that the NHS oversee. We are working in partnership with our colleagues at the ICB and the wider system on looking at what is currently in place, what the evidence base and the needs are telling us locally, and therefore what the recommendations and the pathways need to look like. And that is sat within a wider programme of work around whole systems approach to healthy weight as well. So again, it's flagged amber because against the timescales, what we'd originally set out to do have shifted, but there is a huge programme of work that's underway to assure the board that that is still a continued focus of a number of partners across the system.
Thank you. Do you have any questions on the dashboard? Can't see any hands up. I've got a couple of questions. Just looking at the mental health, and number 20, I think it was in the thing, so I don't have it up. It's just interesting reading about mental health working age residents. Do we have any idea of the scale of the issue? Like do we know anything about how many people miss work because of mental health issues? Do we have any data on the sort of scale of the problem?
So that's something, there are a variety of indicators and insight that we do have. I'd have to take that back and look at that and see what we actually have at a Bracknell Forest level. A lot of what we have coming in is regional or East Berkshire or a boundary that isn't Bracknell Forest. But that said, that there is certainly indicators out there for us to look at. So that's something that we can certainly go and explore.
Okay, thank you. And then with the Making Every Contact Count training, you trained 123 people in last year in 2023. And I was just wondering, is that still going on? Because I think, sorry, I haven't got it up in front of me, I've just got my notes, but I think the number for this year was lower. And is that because everyone who we can train has been trained, or is it because it's something that we're not doing so much now?
Possibly a little bit of both to those, but again, we can get a full update from the team in terms of why that has dropped. So I'll take that as an action. Yeah.
Okay, and then my other question is, so with regards to obesity, and at the moment we're kind of holding this stalling this program because we know it's not working. What would happen today if someone went to the GP and the GP decided that they needed to do some weight management, or they were seen by a health visitor or something? What would happen if that happened today? What would we do with that person? How would we help them?
So in terms of the weight management offer, what we are piloting is an online offer. This is for adults. So that would be the initial community-based offer. And there are a whole host of free weight management and paid for weight management type approaches. So at the moment, that is the offer for adults. For children and young people, the evidence base out there suggests that the family approach and tackling that through the captive audience of the school setting, so a whole schools approach is the way forward. And so that is something that we're looking to work up with our colleagues within education and early help to explore the existing support that's in place for that, and how we feed in the evidence-based elements around healthy weight messaging, but also the importance of the environment in terms of families and children, and access to green and open space, and access to healthy nutritious food options, and when I say access, that's geographical access as well as affordability too. So there's a lot that plays in terms of the environmental role over and above services.
Brilliant, thank you. And have you set yourself a date to have your new obesity strategy? I mean, is that something that could be at the next Health and Wellbeing Board meeting, or do you think it might take a little bit longer?
We can certainly bring an update, even if it's not the full strategy.
Okay.
So certainly look to put that on the agenda next time.
Okay, brilliant, thank you. Just before I hand over to Sue's question, I just also want to say that it was good to see that all your referrals now, I think their mental health referrals are done via Joy, and it's good to see a system working and everyone using it. So that was really good to see. Thank you. Thanks. Right, Sue, over to you.
Thank you. I don't know if I'm going to articulate what's in my thought process very well on this, so apologies if it's not 100% clear. I'm thinking ahead to the delivery of an SEMH school in the borough, so social, emotional, mental health needs school in the borough, and really cognizant of the various activities and key actions in here that are associated to mental health and supporting young people with mental health challenges. And I wondered where the interface was, or if we had any interface between these actions and the plans to develop that SEMH school and its provision, and whether there were some opportunities we could take forward now that would enable sort of a smooth landing for that, the provision of that school. I'm sure it's something you're thinking about, but hopefully I've articulated the question that, the curiosity, I guess, I have in my mind around that.
Thanks, Sue. Yeah, I think in terms of the forums and the groups and the crossover where this work programme, particularly I suppose the public health leads and them sitting on the relevant groups and fora that are involved in that, I'm fairly confident that our team members are involved in those conversations, and we can certainly look to dovetail and sit and use the learning from the needs and the evidence and the data that we're seeing under the Health and Wellbeing Board to inform the further development. But I will go and take an action to go back to the team and make sure and understand exactly the detail as to what's being progressed with those conversations and how they're linked into them.
Yeah, great. Thank you, Charlotte.
Okay, thank you. I've got some more questions on the dashboard, but I'm just wondering about time. I can't remember how much time we should be giving to this. Sorry.
I think we were going to give this about 20 minutes, so we're probably just about done.
Okay, all right, I'll stop there then.
But share them separately and we can pick those up, Megan. That's fine.
Okay, I will do. All right, thank you very much. Sorry, I'm working off my phone for the agenda. Right, so if we move on to agenda point number 8, healthy communities transforming our collaboration to support prevention. Is that you again, Charlotte?
It is. I'm doing a dual show, well, triple show with Abby and Phil on this one. So I will share my screen to go through the presentation.
Thank you.
Apologies, I'm just making sure that I'm sharing with audio because we've got a video to share. Bear with me. Is everybody able to see my screen?
Yep.
Yes.
Okay, lovely. So thank you all. So with the refresh of the health and wellbeing strategy that's up and coming, Abby, Thomas from the communities team within Bracknell Forest Council, myself and Philip Bell from Involve wanted us to think about as a board the opportunities that there may be, because we have a lot of conversations that are going out at the moment, and much focus really at place level around community empowerment, around neighbourhood integration and those community-led approaches. So really for us to just take this opportunity and think about the importance of empowering communities, shifting that balance of power, building the resilience that's so integral to improving the health and wellbeing for all, but really focusing that shift from reaction and service provision and response upstream to prevention. And so we wanted to use this opportunity to highlight some of the conversations that are being had, some of the approaches and the strategies that are in development that focus on working with our communities, bringing in the community voice into what we're doing, and for us to have a little bit of time in then exploring what does that mean for the health and wellbeing strategy moving forward and for us as a board. So I've got a video to play.
Resilience is not a new concept, but it has become subject to renewed interest and attention. Why? Because today we live in an age of multiple challenges, and despite a sharpened focus on tackling health inequalities in recent years, the wealth gap and the deprivation associated with living in poverty remain deeply ingrained and difficult to fix. Increasingly, papers and reports refer to resilience as a key characteristic that people and places should have more of. Rather than wait for problems to strike, it is better to support people and communities so that they can handle risks and challenges. This is not only better for services, it's better for people and communities who feel more in control as a result. People can mean different things when they talk about resilience. A scientist might describe how much pressure, stress or force a material can take before it breaks. This can lead to an understanding of resilient people as having mental toughness or inner strength. These qualities, though useful, are difficult to create in people, and this way of thinking about resilience doesn't consider the root causes of the stresses and pressures that affect people. And what about the people who have more stresses and pressures than others? Can we blame them for being less able to cope? No. Resilience is about more than what is within us. Looking into the sources of resilience confirms that it's not all about individuals. The first people to study resilience worked in child development. They wanted to understand why some children did better despite the odds being stacked against them. By looking at successful children from disadvantaged backgrounds, they found that individual children were more likely to be resilient if they had confidence in their ability to control their own lives and futures, intelligence, a capacity for problem solving, the ability to think about the consequences that their actions may have in the future. These are clearly individual qualities, and to have them is helpful. But the researchers found that resilience also depends upon how a person accesses networks of support, or how a person relates to others. This involves qualities such as empathy, sociability, expressiveness, and warmth. These relational qualities suggest that sources of resilience go beyond the individual, or what is within us. Resilience can have more to do with being able to ask for help, and having relationships of trust that can be relied upon in times of crisis. That is, what is between us. The source of a person's resilience is often the community that they belong to. The question then becomes, how can people be supported to have access to both the individual sources of resilience and a strong community network to draw upon? It is also important to understand the different types of resilience in order to provide people with the most effective forms of support. The first type of resilience is about getting back on your feet, maintaining the status quo after a crisis. The second type of resilience is about being able to take advantage of change, to transform, in order to be successful in your new environment. Let's think about someone who loses their job in food manufacturing. Status quo resilience, bouncing back, would concern getting back on their feet and finding a new job. Access to networks and support, such as close family and friends, is crucial to helping the individual get through the initial shock. What if a person not only loses their job, but the factory in which they work closes as that manufacturing industry disappears? This requires transformation, a change of occupation. In this situation, close family and friends remain important, but this individual will also need support from a wider network of people who know about new opportunities and how to access them. Here, a person's links with others becomes vitally important, and 3 types of relationships are needed. Support from those close to us, who share our values, understand our outlook, and help us through. Links to people who have different values and know about different opportunities to help us on. And links to people beyond us, in particular, those who make decisions about our community, to help us be heard. Resilience is about how individuals respond to different kinds of challenge. However, community support to help individuals flourish is important in the face of the challenges that life presents. Resilience is about what is within us, what is between us, and what is beyond us. We can all think of examples of the supports needed to enable coping and transformation. We will also be aware of some barriers to change, which are difficult for individuals to fix alone. How do you support the resilience of people and communities?
So I'll just let you have a bit of a think about that and the framing of what we're talking about when we're talking about resilience. And I'll be handing over to, I'll pause this, handing over to Abby now to talk through some of the strategies and the approaches that is being taken within the communities team to think and explore that a little bit further.
Thanks, Charlotte. In terms of that question, how can we work together and collaborate to support communities to be resilient? We've got a wide number of strategies that are currently focused on communities and links to communities. And what we're proposing to do at Place, and very much in collaboration with partner organisations and also working alongside communities across the borough, is to work over the next 12 months to develop a community strategy which is focused on how we can transform the way in which we work with and work alongside communities to further develop resilience and to really take a preventative approach and focus more on early intervention. So we'll be looking within the strategy at our ways of working with communities, how we can build on what we know has gone well from previous pieces of work where we've intervened and worked alongside community groups and community organisations. How can we create the conditions to enable connected communities and strengthen relationships across communities, and also enable communities to take action and develop further community projects, community organisations, and really help people to work together and support each other to stay safe, to stay healthy and well. So the vision is that the strategy would have a 10-year approach to it and very much be produced in collaboration at place across the system. Thank you, Charlotte. Oh, I think we skipped a slide there. Thanks. So at the heart of the strategy, it's looking at how we can transform how we collaborate with each other and with communities to support prevention and strengthen community resilience. And there are a number of elements to that, looking at how we can use third spaces, so those community venues that we have right across the borough, community centres, libraries, some of the other sort of service space and community space that we have, to enable people to come together, to connect, develop, form relationships and new community groups, and that work be underpinned by the work that we do across arts, culture and heritage with a number of organisations across the borough, and with the opportunities that are provided by sports and leisure activities across the borough to bring people together to develop relationships and identity. And then the other and the second element of the strategy, supporting more of the psychological resilience, is further enhancing and developing our approach to community cohesion. And the importance of that can only be underlined by the national unrest that we saw in August. And we've got a large amount of community engagement that's already ongoing, but how can we further work together to develop and enhance that community engagement, and to encourage really empowered communities and communities taking more action to tackle and address issues for themselves and to support each other, as we saw so strongly during the COVID outbreak, and the number of volunteers that stepped up and came forward then, and the way in which people worked alongside and helped each other. Thanks, Charlotte. So in terms of the development of the strategy, it's planned to work together over the next 12 months to develop it and very much take a co-design and co-production approach. We will be starting to work on the strategy from January, and in terms of the approach to developing it, it will be designed with partners and with their involvement, and we would hope that partners across the voluntary sector will be working alongside us to support the engagement process and to have conversations with residents, taking very much a strengths-based approach and looking at what's working well within the borough and the strengths that different communities, both geographical communities of sort of association and identity, have got. We'll be mindful of ensuring that the development work links into what's already happening in terms of community engagement. We need to build upon that, and we'll also need to ensure that the development of the strategy takes place in a way that's really inclusive and accessible and relatable to all residents, and particularly think about our language in terms of how we go about having the conversations that focus on developing the strategy. So a 12-month process. We're told this is ambitious by Wokingham, who've been working on this, and Phil will underline this. I think Wokingham have taken 18 months on their community vision, which has just been endorsed and adopted by partners right across Wokingham Borough. Thanks, Charlotte. So in terms of the governance and sort of oversight for the development of the strategy, it's proposed that a new partnership group will be formed to take forward this work in developing community resilience. And a number of your organisations will be approached to be a part of that partnership. We want it to be a a partnership that cuts across business, a number of public organisations, as well as the voluntary and community sector, and ensure that the voice of residents is also heard within that partnership. It will be chaired by the Cabinet Member for Communities, with a Vice Chair coming from the voluntary and community sector. And we'll also be ensuring that there are really strong links to a number of the other partnerships already in existence, including the Health and Wellbeing Board, who have communities and development of community resilience are really at the heart of the strategy work that they are focused on. There'll also be, as mentioned, a significant amount of collaboration with the voluntary and community sector and all of our key partners across sort of health and more broadly wellbeing. Thanks, Charlotte. So now I wanted to move on to talk about the Thriving Communities programme, which is really a programme that looks at how we can work differently with communities and puts a lot of what we've been talking about in terms of the development of the community strategy into action. The programme is a 3-year programme that's jointly funded by the ICB and Bracknell Forest Council through the Better Care Fund, and is delivered very much in terms of a partnership approach between health, the council and the voluntary and community sector. There are 2 key aims to the programme. The first is focused around supporting people to help people to stay well and healthy, so reducing health inequalities, ensuring that we're working to maximise wellness and increasing self-care and resilience. And that work is really delivered through a programme of co-production and working alongside communities and a number of community development initiatives focused on prevention. The second element of the programme is looking at how we can transform the way in which we work together, our relationships and our collaboration across Bracknell Forest as a place and as a number of partner organisations within the health and wellbeing system, to ensure that we're embedding co-design and co-production, transforming the way in which we work with and alongside communities, so that we are have a culture and processes in place that are best set up to enable us to respond to and to work with communities to develop that preventative approach and further strengthen resilience. We're now in the first year of the programme, the pilot year, and just wanted to give you a bit of an overview of the work that's taken place so far. We're 6 months into the first pilot year, and in terms of the community co-production work, some of the highlights so far have been that we've identified the pilot community to focus on, and that work was done based on looking at a range of data sources and insights information about community needs, deprivation, health and wellbeing data. And the first year of the programme is focused on working with people who are living in the town centre ward, and particularly looking at and focusing on a number of the both the new and some of the older flats in and around the town centre area. A couple of delivery teams, project teams have been set up. So one is focused on oversight of and supporting the delivery of the co-production work, and the second project team is driving forward the work on the organisational development and culture change. The pilot year work was launched with a really successful engagement session with partner organisations that are working in or based in the town centre, and there's been a huge amount of support from those organisations, and they've been actively engaged in supporting the focus of the programme now, which is very much engagement sessions with residents that are living in some of those flats and blocks. So we're halfway through 7 engagement sessions where we're having conversations with residents, asking them about what they particularly like about living in the town centre, and identifying the sort of strengths and what they feel needs to be sort of further looked at, worked on, development, how they can get involved in doing that. Very much looking at where their interest lies and the types of activities and groups that they would like to see established to meet health and wellbeing needs. In terms of the second part of the programme, the organisational development, we're looking to build on work that's already been done in terms of co-production. So the council with partners last year put in place a co-production framework and toolkit and guidance for staff working across a number of our organisations to use. And we've been also bringing together a co-production network to share learning around working alongside communities. So the focus is now on developing an action plan to take that work further, focused around a number of key themes. First of all, looking at culture and how we build understanding of working with communities, co-production and co-design. Also, second area we're focusing on is around the tools and the processes that are needed to support staff in working in this way, so getting the foundations right, and then looking at how we build skills and confidence in collaborating and working with communities through co-design and co-production, and finally ensuring that we're really then embedding that behavioural change across organisations. Right across the system within Bracknell Forest. The final element to mention is that we've just also appointed some independent evaluators to work with us on an evaluation framework. So that work's progressing really positively, and communities are starting to be engaged in and are going to be involved in the development of that framework. Thank you, Charlotte. I think at that point I'm going to hand over to Phil.
Lovely. Thank you very much. Thank you, Abby. Okay, so many of us will be aware of the national conversation, which is currently in play, which is looking at how we reconnect, reset and rebuild our NHS. Whilst we have no specific proposals in place yet, we know that there are three potential themes for change. Moving more care from hospitals and out into communities, and that's both in respect of prevention and indeed recovery. Moving from analogue to digital solutions, so making best use of technology, and moving from a position of sickness to prevention, so tackling sickness or illness at the point of causation, so addressing causation at a very early stage to prevent sickness in the first instance. This is a broad and public consultation, and what we hope is that the outcomes from this will lead to change, which strategically sits differently from our existing long-term plan. Thanks, Charlotte. Okay, so in terms of how we are looking to get that public voice in both the national consultation and Frimley consultation too. Frimley have what's called a VCSE Health Alliance, that's the Voluntary Community and Social Enterprise Health Alliance, who are taking some leadership in hosting community conversations across the Frimley geography. We're lucky enough within our alliance to have 158 member organisations at the moment, all of whom have been called to action to have conversations with their respective members, so that we can hear about lived experience, we can hear what matters most to people in our communities, the hopes and the challenges, the hopes that they have in terms of health and provision for the future, the challenges that exist currently, and importantly, any ideas that they might have for change. The conversations are supported by a small grant scheme. So again, we're really lucky within Frimley to have a small pot of money that is allocated to support these conversations. We recognise within the VCSE that we have micro organisations who struggle perhaps even to afford costs of public building to host a conversation. So we hope that by having a small grants programme, that we'll be able to enable some of our smaller organisations and our community groups to have those conversations to build that rich picture of what people would like to see into the future. The Alliance itself will be hosting 4 conversations. We have 4 subgroups that sits within the Alliance, starting well, living well, ageing well, and neurodiversity and autism. So each of those subgroups will be having conversations with those members who are best placed to offer insights from those cohort groups. Bracknell Forest charities and community groups will also be, or are actively being encouraged to communicate their ideas, as has already been outlined, to really build a clear picture of what the people that are living within the Frimley Geography Health and Care System would like to see in terms of their healthcare into the future. Involve are working in partnership with fellow CVSs, that's the Council for Voluntary Services or infrastructure charities across the Alliance. There are 7 of us in total, and taking our community conversations out onto the road. We can't do that alone. We have already been in consultation with Healthwatch, with our Older People's Consortium members, many organisations there, and some of our children and families charities too, so that we get a really good breadth of data and of ideas that we're able to build upon into the future. Thank you, Charlotte. So this is just kind of an articulation really of what's already been talked about, the notion really of co-production. I think this is an example of really a governmental change in trying to really hear voices of people, and how we're stepping up locally to enable that. We have 2 timelines attached to the consultation. The national consultation is a very short timeline as it ends in December, so prior to Christmas. We realise, of course, that this is a really busy time of year for many of our communities, and many of our charities, for example, will be going into the festive celebrations now and mobilising a lot of their resource for that purpose. So in order that we can hear voices and really reflect upon those carefully, Frimley are going to keep this consultation open until the middle of February. So whilst not all of the information that we will receive can go into the national conversation due to the timeline I've already outlined, actually we will still hear the broader messages, and we can still take those into consideration as we plan our health services locally for the future. Importantly, there is a real shift in that power dynamic. We're moving towards the communities being empowered through our community, local voluntary community-based sector, to have a voice and to really shape what provision looks like for them into the future. Thank you, Charlotte. Okay, so just a couple more bullet points from me around the VCSE visions. This is kind of broader. What are we looking to do in the time ahead, or certainly in the coming 12 months? But what we're looking to do certainly is to continue to address inequality across our communities of Bracknell Forest. And I think that Abby and Charlotte have already touched on some of the approaches that we are looking to collaborate on, including, of course, our Thriving Communities agenda, which I think will bring, as a sector, incredible value too. We're also looking to collaborate through our partnerships. I've just alluded to our Older People's Consortium. That's a collective of many charities that come together to think about the older residents of our borough, what their needs might be, what health inequalities they might be experiencing, and how best we can challenge that, we can advocate, and we can find solutions for people. We're also in the process of forming a new children and families or children and young people's network within the sector, which again we hope to do very similar things in that space to what we're doing through the Older People's Consortium. We plan to work collaboratively with our systems partners. Never has it felt more important, actually, that we're all working in collaboration, given that there are so many societal challenges that we're all experiencing, whilst, of course, advocating for those cohort groups who are seldom heard, because often our organisations are the very organisations that are hearing those messages in the first person. We'll be looking to rebuild for recipients of services. We'll be looking to, build resilience for the recipients of our services, reducing delay and ultimately preventing the need for statutory provision. We realise that statutory partners are inundated, and that we play a really important role actually in finding pathways for residents, whether it be about health inequality or other forms of inequality into the future. And we'll continue to bring our local intelligence, our insights to help to shape and inform health and social change into the future. Thank you, Charlotte.
Thanks both. Really interesting slides and information, and thought-provoking, really. And I guess it's just now to play back to the board, thinking a little bit about the alignment of the programmes to ensure the coordination across place. So there's lots of conversations being had, there's lots of approaches of engagement and co-design and co-production, and the importance of making sure that we're aligning that, because it's one community and one population group that we are working with here. So to come from varying viewpoints at different timescales, it's not helpful in building those relationships and that trust with our communities. The other thing for us to think about is capitalising on the conversation and what is being heard, and making sure that we use that insight to inform where we take the health and wellbeing strategy moving forward, but also thinking about the how we're doing that and the infrastructure that's being developed and that is in existence with our colleagues, our VCSE colleagues and partners, and drawing upon that and helping and investing in that to develop and strengthen that the community's voice further in that strategy setting. And then just some practical points around the structures that we've got, individuals and partners, and who needs to be involved in that, and how we align the work of the Health and Wellbeing Board and the development of the strategy moving forward with the focus and the priorities that are interlinked and complementary elsewhere in the system. So I'll stop sharing there and open it up to conversation.
Brilliant. Thank you to Charlotte, Abby and Phil. That was really good, really interesting. Joanna, I can see you've got your hand up. What I would say is we're quite limited for time because Amy wants to present and then she's got to go at 3:30. So Joanna, quick, and also I'm at the adult social care, I'm at the social services conference, and loads of this kind of feeds in with loads of the stuff we're talking about here at the conference, and I could talk about this for ages. But let's just keep the questions really brief, and then Amy's got time to do her presentation. So Joanna, do you have a question for us? You're muted just now.
I do, but I can pick up with Phil separately if we push for time, Megan.
Okay, thank you. I can see Andrew's got his hand up.
Mine was just more a comment. So there's so much richness in that we can't do any justice in this kind of setting. And it's just a question about whether we give ourselves a bit more time at the next meeting, which is in person, for a bit more of an in-depth bringing this together, because I think there's so much in this and so much beneficial stuff that we could do collectively that maybe that would be a step forward. Just a thought. I think that's a great idea. I'd certainly support that, definitely. And then I could bore you with all the stuff I'm learning at the conference at the moment as well. So yeah, fantastic. All right, thank you so much for the presentation. Amy, is this going to give you enough time to tell us about your all ages carer strategy?
Yeah, it's a bit of a mouthful. Yeah, thank you. It's really just a bit of an update on the action plan development. So hopefully it's something people will be very familiar with anyway. So if I just, it's in a report format, so I won't pop it on the screen unless you'd like me to, or if people are happy just to scroll through, or you want me to put it up.
Amy, I'd quite like you to, because I'm only on one little tiny screen, so I can't.
Yeah, of course, no problem.
If it's easy, it would be much.
Yeah, no, yeah, it's just obviously like most people, I'm used to Teams, so it's like, oh, it's.
I know.
Zoom, so I just need to. How do I?
I think that bottom, the green buttons, share screen.
Here we go. It should hopefully be here. I'm just trying to find it in the documents I've got open. Hold on a moment. Let me see if it will come up there. Apologies, I'm just trying to get it up. Apologies, I'm just trying to get this up.
Well, if it doesn't work, you can. I'll just have it up, but then I won't be able to see if anyone's got their hand up. Just go ahead and then just, okay. I know I've got it. It's just I can't do both. But yeah, that's fine. Go for it.
Sorry about that.
That's okay.
Yeah, so basically I was just asked to come along today because as people will know that we, following the co-production of the All Age Integrated Carer Strategy, we undertook a 12-week public consultation, and following approval that the carer strategy was published in the summer of this year. As a result of that, obviously there were a number of priorities in there, which obviously we need to develop actions for. So we formed a carers partnership board, and that is a partnership board which I co-chair with a working age carer, who was Carla, who was very integral to the development of the strategy and the co-production work and was part of the steering group. And that partnership board obviously has a number of key stakeholders from adult and children's social care, partners from health and the community voluntary sector. One of the first activities that we've been tasked with as board was to develop a detailed 5-year action plan to sit alongside the strategy in terms of how we would deliver on those 5 priorities. So just a reminder, in terms of the 5 priorities, priority 1 was recognising and supporting carers in the wider community. Priority 2 was services and support that work for carers. Priority 3 was employment and financial well-being. Number 4 was supporting young carers, and number 5 was supporting young adult carers. And they're that really are the priorities at the heart of the strategy and what people told us, carers told us were important to them as part of that strategy development. So in terms of development of the action plan, each of those priorities has become a work stream and has had a sponsor and 2 work stream leads who have been responsible for setting up those work stream group meetings, engaging with relevant stakeholders, looking at in terms of obviously how we're developing those actions into projects, risk and issues log, all of that sort of project activity. And then responsible for reporting up into the Carers Partnership Board. So if you, in terms of in the pack, so there's obviously that very brief report, there is included also a just a copy, a link to the executive summary of the strategy. And obviously this is a published document, so it's in the public domain, anybody can access it. The executive summary sets out, under all of the priorities that we've identified, all of the actions that we need to take to deliver on those priorities in terms of what carers told us. And then I think it's fair to say, sort of moving, so I mean, I don't plan to go through those in detail. Obviously, I'm assuming people have had an opportunity to read those. In terms of the action plan, which is the last document in the suite of documents about this. So I guess really what we have here in terms of the action plan is kind of a chunked up version. The action plan we've actually developed is a very large Excel document. It's incredibly detailed and holds a lot more information in there. More than happy to share that if people want to see that more detailed action plan. But this was really sort of chunking up so we could give a really clear really clearly demonstrate in terms of when we publish what the priorities are, what the priority outcomes we are looking for under those priorities, the activity and actions we're undertaking, who's leading on that work, when it will be delivered by, and the measures we'll be undertaking to ensure delivery. So if you work through that document, you can clearly see under each of the priorities, we've identified those priority outcomes and all of those areas you've looked at. I mean, obviously I don't propose to go through each one in detail because I think we'd be here for the rest of the afternoon. So I'm hoping people have had an opportunity at least to read through that and feel assured that through the development of that action plan, we are really targeting those areas in the strategy that we need to in terms of delivering. So in terms of, I guess, recommendations and next step, we're looking to progress that action plan through for approval. And I know that I'm aware that we're keen to have a sort of a members session on that, just in terms of understanding and shaping that delivery plan. So we felt once we've got this kind of draft plan in place, that would be a really good juncture to do that. Once we have all that finalised, we'd obviously want to publish that agreed action plan and share that with partners and more widely with stakeholders. And the proposal is for the governance of the action plan to be overseen by that carers partnership board as that first level of governance, which I think it's really important before we report up into other various arenas and boards, etc. I'm conscious that's a bit of a whistle stop tour. And as I said, I haven't gone into masses of detail on the priority areas and the actions we were looking at, but I don't know if anybody had any questions or there was any further clarity needed on any of that.
Thank you, Amy. That's brilliant. And I mean, I don't know about other people, but I've seen this strategy quite a lot. I think it's excellent. Andrew, I can see you've got your hand up.
Yeah, sorry, I'm a prolific hand putter-upper. Just a thought. I am assuming that there's going to be a sort of like a regular review of the actions and progress through.
Yeah, absolutely.
And I just wonder whether it would be useful for the Health and Wellbeing Board to get a sort of a short version of that on a sort of an annual basis, so that we can just track through how this is progressing and how it may link in with some of the work that we'll be doing in terms of developing our new strategy, but also some of the work that we'll be doing and bringing to the board. So if that's useful, I think that would be something that we would like to see.
Yeah, absolutely. I think we'd be really, really keen to do that, because just in terms of keeping the profile high in terms of the work that we're doing, but also, as you say, just linking into other those key, more broader strategies around health and wellbeing. Yeah, absolutely.
Okay, fantastic. Any other questions? I think it's great, Amy. It's amazing. It was really good to see the timeline for it. What I would say is I don't know what I'm guessing ASCOF stands for Adult Social Care Operating Framework. I don't know. And then also SACE. And I guess it's that thing of we just need to be really careful with acronyms. And what I would say is, if it's fine to use acronyms, but the first time you use them, always say what it stands for, because then if you get stuck, you can just do Control and F and work out, right, what does that mean? And I would say that in the public facing one, you also use NEAT. And although most of us will all know, even I know what NEAT means, but if that's one that's going in the public domain, we probably need to say what NEAT stands for as well. So that was my only kind of layperson sort of view of it, but I just think it's brilliant. And again, at this conference I'm at now, there's loads of stuff about carers. I went to talk about carers and new carer strategy, so it's great that we're kind of ahead of the curve on this one. So it's brilliant to see. Thank you.
Brilliant. Yeah, no, definitely take up all those points. It's a very easy trap to fall into, so it's really important to get that feedback and really be reminded of that.
All right. Any other questions or observations on this? Great. It would be great to see it being enacted as well. So thank you.
Brilliant. Okay. Thank you for your time today. Thanks. Bye.
Thank you. Thanks, Amy. All right. So we're now moving on to Health Watch. So that's Joanna and Paul, is it? Wherever else?
Hello.
Yeah. So yes, thank you so much for your report. Do you want to talk us through it?
No problem at all. I've just got a few slides. I can get them up. We're all used to Teams, aren't we? I think sometimes it's that. Is that showing in slideshow?
Yeah, that's showing.
Yeah. Okay. Brilliant.
Yeah.
Yeah. Are you sure, Andrew?
Not sure if it's in slideshow.
No, it's looking like a web page at the moment, but that's fine.
Okay, you can see it clearly there. Oh yeah, it is. I'll scroll down.
Yeah. Okay.
So our annual report, this is from beginning of April 2023 to March 2024. We usually publish in June, but due to the election this year, it was delayed till after the general election. So the full annual report is available on our website, along with all of our other published reports as well. So if anyone's interested, obviously there's much more detail there, but Nick's just prepared a few of the highlights for me to talk you through today in this meeting. So in total over the year, 1,565 people shared their experiences of services in the Bracknell area. And we also provided advice and information to nearly 35,000 people. We had a number of reports during the year. So one of the reports that we published was about the experiences of people using our local hospitals. And we go regularly every month into Frimley, Wrexham Park and Heatherwood hospitals to talk to patients, family members and occasionally staff as well in those hospitals. Since this annual report, we've now had a second sort of 6-monthly update on this programme of work. So if you are interested in learning more, there's a second report on the website. We had some feedback from the ICB, and they were, really thankful to receive that feedback and communication from patients. There was a fair bit of feedback about communication in this particular report, things like letters, texts that go out to patients and where there can be issues there. And obviously this was during the period where we had quite a few strikes with junior doctors and things going on strike, so that communication around appointments changing, and the feedback that was provided to Healthwatch by patients at Frimley and Wrexham was really useful to the team who are looking at improving that feedback and communication to patients. So that was a good outcome. We also signposted people to the hospital complaint system, to PALS, to advocacy if appropriate, and also we have a telephone line and a web service where we can provide more information and signposting as well. So where it was a bit more of a complicated picture, or people wanted to go into detail about a number of different services and issues, we can signpost them to get that more in-depth support from Healthwatch via our telephone line. We also talked to patients about the same-day primary care offering. This was particularly over in Slough regarding Wrexham Park Hospital, and maybe the awareness of that at the time not being quite as high as it could have been. So we fed that back, and there was some more communication produced and new signage to go out on the roads to sort of direct people round to the site at Priors Close in Slough. I need to scroll, sorry. Sometimes we do engagement which isn't linked to a report, and it's quite nice to capture some of that sometimes, because although it might be a smaller piece of work, there can be some good outcomes from it. So these are 3 of those engagement activities. We joined a group of primary schools from Bracknell, Windsor and Ascot who had invited, I think they were year 5 and 6 pupils, to participate in a mindfulness day. So we went along to talk to the children about, what supports their well-being, what makes them feel healthy and happy. We did some mindfulness colouring activities with them, and then provided signposting to their school workers who were there with them on the day. And listen to the feedback that they're able to provide as well. And then we went to the local macular support group and the deaf support group about their communication needs, and that did feed into a report about accessible information. But what we found is that people didn't always understand what they're entitled to, and even when they did understand what they're entitled to, it wasn't always easy to find the information in the format that they required it. We also talked to the public about ways that they access their GP, some of the difficulties that they face, and we share that information with our colleagues in the primary care system. We also have worked on project work in the following year around carers for people with dementia and others who might not be able to access the kind of digital methods of primary care, and have continued to sort of raise and highlight those challenges that certain groups and individuals face. I've spoken a little bit about the accessible information report. I won't go into a huge amount of detail on that one because you can read the full report on our website. But we had communication with people with learning disabilities and various types of sensory loss, and it's just all about getting information in a form that they can easily understand, so that they get the same access to health information and services as the general population. And with our report, Frimley said they're in the process of redesigning their website, so all of that information will be helpful in making sure it's as accessible as possible. And while they can't create all materials in all formats, they were looking at which were the most important ones to the people in the target demographics, to make sure that they were as accessible as possible. We also have a program called Enter and View. And in an Enter and View visit, Healthwatch has a legal right, a statutory function, where we can enter any premises where health or social care is being provided, and we can do a review of that service with a particular focus on talking to individuals. In the context of care homes, that would be residents, or it would be family members who support the residents in that facility. It's not an inspection, so the CQC does an inspection. We have this as a sort of an alternative or an add-on to what the CQC may do. And we went to Bracknell Care Home. That was actually the first of our Enter and Views that we'd done since the pandemic, because obviously we had to pause that activity during COVID. And it's been a real success for us this year. We've had a full programme of Enter and View across Bracknell and our other local authorities in East Berkshire. So again, that report is available on our website for you to have a look at if that's of interest. And what next? Obviously, we're already working on what next, because this is referring to this year. So we have 3 priorities for this year, which are women's health, young carers, and hospital discharge. We are working on a women's health project at the moment. We have a survey which we're circulating with residents. So if it would be acceptable to members of the board, I can circulate the information about that survey for you to be able to pass on to groups that you're working with at the moment. I'm just going to stop there. I'm not quite sure how long was allocated in the agenda, Councillor Wright. So if you want to let me know if there's time for questions, that would be great.
Yeah, sorry, we definitely do have time for questions.
Brilliant.
It was more we needed to get Amy in before she disappears.
Okay.
So yeah, I mean, I feel bad for cutting Charlotte and Co short on their brilliant presentation. But yeah, I can see some hands going up. Paul, was there something you wanted to add to Joanna's presentation?
Yeah, so first of all, I have been blown away by the work that the guys are doing with the limited resources they've got, because as you probably know, they cover the whole of East, Joanne's team cover the whole of East Berkshire, so quite challenging what they can actually, that report's replicated 3 times across the 3 boroughs and different pieces of work going on. So yeah, I'm just soaking it all up like a sponge at the moment. We are got a workshop, isn't it, in January that we're going to do with the Strategic Advisory Board. So that's why I'm really interested in getting as much information and data and feedback, and already I'm overwhelmed with the amount of stuff that's out there. I think the real challenge for us next year, really, isn't it, as a team, is to look at that and to see where we put our priorities, because there's so many areas, and I worked in the NHS for 20 years, so huge fan of the NHS, just to be clear about that. Where do we put our effort, because we've got limited resources, and what's actually going to make a difference, really? So we're really looking forward to our workshop in January, and then we'll be able to feedback what's coming out of that, but really want to ensure that we're actually listening to the public, and what it is going to make a real difference to them. But already loads of ideas from this afternoon's presentations, so thank you very much for that. So not really a question, just to thank Joanne and the team, really, in the work they're doing, because I think it's incredible, to be honest.
Thank you, Paul. I didn't pay Paul to be here.
Thank you. No, it's great to see. Andrew, you've got your hand up.
Yeah, just two points from me, Joanna. What I couldn't tell from the report is what drives your priorities for the next year.
Oh, good question. I think that's what Paul was alluding to there.
Is that directly related to what you found out in the previous year, or is it themes?
Yeah.
Or how do you?
So all of our public feedback that we receive, either it might be by survey that goes into reports, or the individual items of feedback, we record that all in a management system. So we can look at themes and trends, and we can look at what's coming out from our previous year's activities. We also usually do a prioritisation survey, which comes out sort of in the beginning part of the year. So we'll ask the public, what do you think Healthwatch should be focusing on this year? We often call it what matters most, which I think was brought up in one of the other presentations that have been done today. And then we look at what other intel and data is in the system. So the health and wellbeing report will be really, really useful. The dashboard, sorry, that Charlotte talked about earlier, because it's all of that kind of rich data. It doesn't have to be what's gathered by us. Obviously, we use our system partners as well. And then on top of that, we'll look at what the national priorities are and other piece of work that come in. So with the women's health piece of work was related to some funding which had been delivered to the NHS as a result of a national strategy around women's health, and that was perhaps an area where there could be some influence at that particular time.
Can I just do a follow-up? Sorry, I might be stealing, I don't know if I'm going to steal Charlotte's thunder, but the data that you collect and the insight and information, there's obviously quite a lot of read across with some of the stuff that we do in public health, and there's quite a lot of focus in here about kind of the NHS specific. But how do we work more collaboratively to sort of share that insight and then implement projects and initiatives that will help for both the issues in Bracknell Forest, but also the ones that you're identifying through your survey work?
I think there's lots of different ways that we could do that, isn't there, Andrew? Maybe we pick up outside of the meeting. We do have regular conversations with public health, and we wouldn't want to try and replicate a piece of work that you're doing, but at the same time, if we've got similar priorities, we can align and use our sort of strength together. So I think that can continue if there's any sort of creative ideas, and particularly that dashboard idea is quite exciting. I know Charlotte said about let's get some of the rich story data in there as well as the figures. So yeah, we're very happy to look at other ideas about how we can share our intelligence. We do have a lot of the stories that we collate obviously are confidential, so we can't just share the link to directly, but there are ways of kind of collating that information as well.
Great, that's brilliant. Thanks very much.
No problem.
Thank you. Charlotte, you had your hand up next.
Thank you. Thanks. That was a really interesting presentation, Joanna. And yeah, Andrew, you've picked up a few points. I guess in response to that, I'm thinking about the dashboard is one part of I suppose our joint strategic needs assessment, that much broader piece. And I'd really like to get that to a space. We had an East Berkshire joint strategic needs assessment previously, and decisions have been made to with restructuring of public health provision to actually bring that back into local place and the individual local authorities. So there's going to be a big piece of development work around the JSNA and what that looks like, and I'd really like to get to a space where it's more than just updating the data and the demographics, that actually it is a central resource and a point of reference that can then signpost out to all of this really rich qualitative insight as well as the quantitative stuff. So I think it's a sort of ongoing conversation between ourselves as to how we not only duplicate work, but how we then what does that look like in terms of making that information accessible to everybody across the system, so we're using it systematically in how we're doing business, whether that's strategy and policy setting or whether it's operational delivery, that data driven approach is central to that. So, and I wonder whether and again, we'll work it through a little bit more. We talked about that face-to-face meeting next time in the workshop. and thinking about maybe that's a broader piece in terms of the approach that we're going to take as a board in refreshing that strategy, and the resilience and the community development is central to that, but so is the data and the insight and how we use that information. So I'll get my thinking cap on, and then we can touch base before the next time as to what that looks like. The other, I just had a couple of additional points and questions, particularly interesting around the digital access insight that you're gathering. I think this shift from analog to digital, yes, it has its space, but it does concern me in terms of driving some inequalities further. And so I wonder, you shared that information with Frimley, and has that been the detail? I know you're here today sharing it, but has the detail been shared with other partners within the system?
Yeah, so well, that particular piece of work was around carers for people with dementia and their access, because obviously within that demographic, when we did the engagement, I think I'm quoting off the top of my head, so I might have to look at the original report, but I think about 97% of them didn't own a smartphone, didn't have a laptop or a computer at home. And so they were really kind of, they just didn't have the ability to use some of those digital methods. And at the same time, they were in a very sort of stressful caring situation where a lot of their time and resources was being dedicated to care. So that report, it is on all of our reports are on our website. They're publicly available, but in that particular one, Nick worked with the dementia carers organisations, and also I know has fed in with the carers strategy that Amy was here talking about earlier. So within that particular population, that piece of work is very well known. And then obviously with the providers, in that case it's primary care, we've continued. So when we publish a report, we don't just kind of put it to one side, we continue to use it to influence and to try to kind of drive forward the recommendations that are in the report and to amplify the voice further. So yeah, we've continued to do that and we went to the primary care briefing last month to present it again and just to ask for providers, what are your creative solutions? Let's have some thinking time, sharing good practice as well, and then continuing with that. So there's lots of different facts. I'm not sure if that really answers your question, Charlotte, but
I guess for us, and listening to Amy's presentation on the carer strategy, it's thinking about the emerging actions and deliverables that are coming out of strategies such as that, and whether they are further being informed by insight and reports that such as the one that you've just described. So it's an ongoing dialogue.
And it is shared. So when our reports are published, it's shared with the CQC, it's shared with local authority colleagues, who then will share onwards to their interested parties, as well as within the NHS and other stakeholders as well. So I think there could be possibly more in terms of, let's find out what happened as a result of that. But the sharing is happening. We could do with a bit more feedback on what happens next.
Lovely. And just sorry, a very, very quick point in terms of your women's health priority. I'm sure there's some work going on in Slough, and it may be linked to this, I don't know. But Sarah Rayfield's the consultant in public health that's picking up that piece of work in Slough. So just to let you know that'd be a key contact for you to connect with.
I think we have that. Thank you, Charlotte.
Fantastic, thank you. It's really exciting. Paul, I can see your hands up.
Yeah, so I think, as I've said already, I think we're doing great work. I think the real change that people might see in the next year, really, and I think I'm the first chair that the organisation has had for some time. I think the questions that have been asked there, I think we've got great data, great feedback. I think Joanne's always very polite. I'll be a bit more straight talking. We need that feedback and the holding to account, really. So we're not the CQC, but we do need to have more of a voice. And certainly there's pieces of work where I've asked the silly question as a new person and gone, well, what feedback have we had in that? And sometimes we've got some feedback and sometimes we haven't. And I think as part of it, as we develop that strategic advisory group, I think we've got some really good people in there. We've got great engagement in Slough. We need to do more work in Bracknell and in the other boroughs. So just give us a chance to get this up and running, get some of our governance sorted out, come up with a plan for next year. I just think there's great opportunities to work with public health. I've worked with public health teams before. I'm really keen to come and see you guys because I think there's some really good stuff we can do together. And let me just be quite clear, I'm quite a practical kind of guy. So love strategy, love it, absolutely. But I'll be wanting to see in a year's time what difference have we made, really. So I'm not about writing bits of paper that look great and sound everyone at the board nods and smiles at and goes, that's a great piece of work. Like, you know, the questions you were just asking there about deliveries and outcomes and how are we going to make a difference to the people in this borough. And Joe knows my biggest hobby horse at the moment is access to primary care. It's shocking in Bracknell. The service is absolutely shocking. We've given some feedback. I don't think we've seen a great deal of change. That's, as far as I'm concerned, that'll be on our list for next year, really. Some of that has to change, really. And that's not just about some of the national issues. There's some local stuff they can do to make the service much, much better. So, you know, give us a chance. You know, I think we've got great stuff that we're doing, a great team. I think we can do more in the next couple of years, really. So that would be my kind of summary of that and working with the team.
Brilliant, thank you, Paul. Nicola, I can see your hand up, and you might just want to quickly introduce yourself because obviously you weren't there earlier on when we were doing the introduction.
Sorry for arriving late.
No, it's fine.
I'm Nicola. I work for the ICB, so within the NHS. I'm the Director of Places and Communities. And so if you get stuck, clearly go for your first routes of getting feedback and stuff. But if you get stuck, you can have my email address and I can help you navigate through that. Thank you for all the work you do. It's truly appreciated. And it's really important, isn't it, that we have partners that we work with that are balanced and so that we get appropriately challenged in the right place and you get feedback, etc., etc. The area that I also just wanted to mention is the importance of the narrative around the 3 NHS shifts that we're all becoming familiar with. Yeah. And actually, I think the most confusing one of that is that analog to digital one. And we just need to make sure that we have a common understanding of what that means. Yeah. The NHS is quite capable of shifting its meaning, but in a purist sense, and the way it's framed at the moment by the minister, it's not about what we think it might be, which is less face-to-face, more technology and apps. It really is about that single patient record and making sure that data is available. So I think both we and our populations are probably going to get most confused about that shift, and we can help each other by making sure we've got a consistent understanding of what it means.
Yeah, I agree. And I think sometimes I went to the Health Watch England conference 2 weeks ago and the minister was talking there. And I think that phrase, we're going from analog to digital, there was a few sort of, you know, because without all the narrative around it, it does sound like people are going to be excluded. But yeah, thank you for that, Nicola. It's really helpful.
Yeah, there are a few indrawn breaths at the conference as well here. Abby, I can see your hands up.
Yeah, just a thanks from me as well, because we've done some really good collaborative work this autumn in engaging with people with disabilities across the borough. Yeah. So a partnership between Health Watch, the ARC involving the council, and there's been the survey is still open. We've extended it now until early January. So I think we've got a good response rate, but we want to try and encourage more. So just to make partners as well around the screen as well, that consultation is still open, surveys open, and yeah, looking forward to hearing from more people. Also really good to see within your report the work that you've done around accessible communications, and that, you know, taking the learning from that, because that's a real priority for us as well as an organisation. It's really good to see how others are approaching that, and I know where the learning is. So,
yeah, thanks for that, Abby. And I know Nick's really enjoyed being involved in that disability access project as well. So thank you.
Lovely, thank you. I really like this enter and view initiative that's come back on. I think that sounds really, you know, it's just that extra level of assurance, which is really good to hear about. So yeah.
And I think for Healthwatch, we are health and social care, which is a huge remit, obviously, but the name doesn't necessarily help because people think health rather than care. So being able to do entry and view in those care environments, it helps to talk to the community, which may not actually come to us to provide feedback.
Yeah, brilliant. Okay. Fantastic. So I've got logged out.
Thank you for all your comments and questions as well. That was great.
No, really good. Thank you. Yeah, I look forward to hearing more news on you know, on these new things you're looking at. Fantastic. Okay. If there's no more questions on that, we'll move over to any other business. Is there anything else that we need to discuss? All right. Fantastic. Oh, Andrew, your hand's up.
Apologies. Just to say, so our next meeting we had down as in person, and I think judging by the time we had today and the stuff that we were doing, it might be helpful if we just added an extra hour so that we could do some workshopping at the front end, so that it starts to lead us into the next health and wellbeing strategy and some of the stuff that we talked about, community side of things. So if the board are happy with that, then Lizzie and I will work with Charlotte and Nicola and just sort of getting the agenda ready for that one.
Brilliant. No, I would, yeah, I agree. I think half a day would be great, or, you know, 3 hours would be fantastic. Okay, thank you guys. Thank you so much. If there's nothing else, I will close the meeting. Thank you. Oh, thank you. Thanks, Sue, for the thumbs up. And
thanks all.
Thank you. And we'll see you all in February face to face. Have a lovely Christmas.
Thank you. Cheers.